Everest nails, clubbing, and all the colors of the rainbow. Nothing can freak one's noggin like your nails turning weird. But what do these changes actually mean? Nail discoloration is one clue that can tell us a lot about our health. If your nails have started to take on a yellow hue, it may be a sign that you've contracted a fungal infection. Men, older adults, people with certain health conditions, or those who live in more humid climates tend to be at greater risk for the condition, which is medically termed onychomycosis. More often seen in the toenails than the fingernails, these stubborn fungal infections can be tricky to treat once they've set in and may require long-term combination treatment with topical medications, drugs, or surgery. Nail yellowing may also be tied to health conditions such as rheumatoid arthritis, lung disease, or yellow nail syndrome. Yellow nail syndrome, although rare and not entirely understood, may be related to blood flow problems or fluid buildup. In addition to developing yellow nails, those with the condition often experience breakage, thickening, and curving of the nails. Of course, it's worth noting that yellow nails may also be the result of painting your nails red without first applying a base coat. Other health conditions that can produce some funky nail color changes include anemia, which can cause nails to look pale. Alternatively, blue nails may indicate a lack of oxygen in our blood. White nails may be a symptom of diabetes or liver disease, while white toenails may potentially indicate a protein or calcium deficiency. Additionally, bleeding due to nail injury may cause toenails to turn black or purple. If you haven't recently stubbed your toe, purplish-black toenails could alternatively be related to a bacterial infection, B vitamin deficiency, or, in rare instances, cancer. Our nails can also take on multiple colors at once. For example, nails that appear half white and half pink may be a sign of kidney disease. If you notice only partial nail discoloration, such as a dark red spot in the shape of a crescent moon, this could signal arthritis, heart disease, lupus, or more.
Parasites or fungus is possible.
Or maybe lupus.
Similarly, a blue crescent moon-shaped spot could be a symptom of poisoning, such as in the case of Argyria.
When did you first realize that you were blue?
Otherwise known as silver poisoning, this can cause skin and nails to take on a bluish tint. If you've noticed your nails have developed a pattern, they may be trying to tell you to give your doctor a call, particularly if that pattern takes the form of dark streaks. A dark, vertical streak that develops down your fingernail or toenail may be a sign of melanoma. Early detection is key in treating this serious form of skin cancer. According to the Skin Cancer Foundation, it's estimated that the U.S. will see more than 200,000 new cases of melanoma in 2024. Alternatively, a condition known as leukonychia may cause your nails to develop a white, spotted pattern. Usually the result of nail trauma, these small white spots can also emerge due to allergies, a fungal infection, or the use of certain medications. For example, it's reported that chemotherapy drugs may potentially affect our nails. Heavy metal poisoning has also been linked with leukonychia. In rare instances, white nail spots may be related to certain health problems, such as diabetes, heart failure, liver cirrhosis, or a nutrient deficiency. If it's due to nail trauma, medical treatment is not usually needed. Otherwise, consult with your healthcare provider. They can help determine whether your spotted nails may be related to a health condition. What nail ridges can tell us about our health depends on which way they're running. Vertical ridges that run the length of the nail, also known as tracheonychia, can be expected as we grow older and the nail becomes progressively weaker. If aging isn't responsible for your vertical fingernail ridges, these textural changes may instead be related to dehydration, nutritional deficiencies, eczema, thyroid disease, or alopecia. If your fingernail ridges run horizontally, these are called Bowes lines. More often than not, these ridges are the product of nail injury, which can include anything from dropping something heavy on your hand to overdoing it on your cuticle maintenance. Bowes lines related to physical trauma are usually temporary. The same is true for horizontal ridges related to stress, which can temporarily halt nail growth and result in Bowes lines forming. In fact, nearly anything that interrupts nail growth can potentially produce Bowes lines. This was evidenced in a small 2005 study published in High Altitude Medicine and Biology, in which researchers found the incidence rate of Bowes lines was 33% in participants who ascended a mountain in the Himalayas. Dubbing this phenomenon Everest nails, the researchers determined that the reduced oxygen levels experienced at high altitudes were enough to disrupt nail growth and produce Bowes lines. In some cases, however, horizontal ridges may be related to fever, illness, kidney disease, or more. If the skin surrounding your nail has become red, irritated, and swollen, it likely indicates an infection, which is known as fingernail paronychia. All it takes is plucking a hangnail too harshly or even soaking your hands in water for too long for this kind of skin damage to occur. While it is not usually cause for concern, medical treatment may be warranted in the event that abscesses or open sores form around the nail. This can make it easier for bacteria or fungus to make their way into the body and increase the risk of the infection spreading, although that is highly unlikely. Having clubbed or curved nails is another health condition that may prompt swelling in the fingertips. While sometimes just a harmless product of our genes, clubbing has also been seen in connection with medical problems of the liver, heart, lungs, stomach, or small intestines. Curvature of the nails is often the first sign of clubbing, and nails may eventually begin to feel spongy to the touch. Although nail changes are not always indicative of a health condition, talk to your doctor if you notice any concerning symptoms. Our nails may not be able to talk, but that doesn't mean they don't have secrets to tell.